Today we'll be going to 2 p.m. on our weekly or now biweekly COVID-19 updates. We'll begin switching to a biweekly format now in the new year. On Fridays, when there's no campus briefing, Michigan Medicine will be hosting town halls for the U of M community. So we'll be doing alternating weeks, campus and Michigan Medicine. To be more responsive and address more of your questions, we're adjusting the format of the briefing slightly. Instead of presentations by campus leaders followed by questions, we'll answer questions throughout the hour. Questions submitted in advance via the form and the live Q&A function will both remain a part of the briefing. Today, we're joined as usual by Provost Susan Collins, Vice President for Student Life, Martino Harmon, Chief Health Officer, Preeti Malani, and also joined today by Rob Ernst, the chair of our Campus Health Response Committee, Sandro Cinti, the co-lead of our Vaccination Safety and Effectiveness team from Michigan Medicine's task force, and each of them will address questions from their areas. I'd like to turn things over to Preeti.
Yeah, thanks, Mark. So happy New Year to everyone, and to our students who are back in Ann Arbor, welcome home. I'm really pleased today that we're joined by my longtime friends and colleagues, Dr. Rob Ernst and Dr. Sandro Cinti, and we'll be able to take a little deeper dive into testing and compliance, as well as the vaccine issues with both of them. So I'm just going to give you a brief overview. I think right now it's a really strange juxtaposition. On one hand, we have COVID vaccines, they've become a reality, and on the other hand, COVID cases continue to surge all over the country. And for those of you following along, we've been topping 250,000 cases a day with nearly 4,000 deaths a day this past week. And the models suggest that this number could go all the way to 5,000 deaths per day. So as a nation, we're not doing very well. But as a state, Michigan is actually seeing good improvement. So if we were grading on a curve, and I'm not sure how often that gets done anymore, Michigan is getting an A, but the median score is not very good. From the health system standpoint, Michigan Medicine is full, which is pretty typical for our health system. But thankfully, it's not overwhelmed with patients who have COVID. And I think that was a concern we've had, and we continue to have that concern. But so far, things are pretty good. In fact, it's pretty much been business as usual, at least business as usual during the pandemic, without a lot of disruptions in care or elective procedures. The big issues right now are vaccine rollout, which has been slower than expected. And there's a bit of a lull in Michigan. We'll hear about this more from Dr. Cinti. The other issue that I just want to mention is the emergence of this B117 variant. People have heard about this, like the UK variant, and there's a lot of unknowns about this, but it does appear to be more contagious. The data do not suggest that a difference in illness severity, at least now, but we are very concerned that if this becomes widespread in Michigan, we could overwhelm the system. If you ask my kids, they will tell you that the pandemic started in March last year, but the rest of us know it actually began in January. So it's been a year for us, just about exactly a year that we started doing campus planning. And as has been the case throughout the pandemic, public health officials, clinicians, emergency planners, we really face this ever-changing narrative where we have to make decisions based on the best information available. And unfortunately, sometimes that information changes from morning to afternoon. And while the world waits for widespread vaccination and additional data on treatments and prevention, locally, we need to really double down on some of the basics, which means avoiding large gatherings, wearing face coverings, maintaining your distance, and really for the students, finding ways to stay connected with your smaller social groups. And again, I hope people can find ways to make the best of this semester, whether you're with us in Ann Arbor or you are joining us from your permanent homes. It's not going to look and feel normal, but hopefully it's going to be a good semester. Just a couple housekeeping things. Responsive Blue, please update your app. When you do this, the undergraduates are going to see a box that indicates their testing verification status. And I know we tried this out, both Dr. Ernst and I, within our homes. Our kids tried this out and it actually worked really well. The app is going to look a little bit different if you are enrolled for undergraduate classes, and it's available in the various app stores. We're going to talk about some of the specifics of testing and compliance with Dr. Ernst. I just do want to make a plug that even if you're not in the quote mandatory groups, we really are encouraging everyone who comes to campus regularly to get tested. even if you're living off campus and in all remote classes. This is really about supporting the health and safety of our community. This is not going to end quickly. Unfortunately, this pandemic is going to be with us for at least a few more months, but we're almost there. And we have tried very hard to streamline the testing process. We'll talk about that a bit with Dr. Ernst. In fact, the testing program worked with the student government to really work on making this as easy and convenient as possible. For example, there's a new testing location at the Ross School of Business. So we'll talk about that a bit. So for now, welcome back. Be safe, be kind. Go play in the snow today if you have a chance, because it's beautiful out. And hopefully all of you will join in on some of the MLK Day activities on Monday. I'm gonna now take it over to Provost Collins, and we have a couple questions that we're gonna include here on a slide in a moment. These are questions that came in from the audience. The first one is, given that Ann Arbor schools are still online and the Families First Coronavirus Response Act has not been extended by the federal government, how will the university step in to fill this gap?
Thank you very much, Dr. Milani. That's an important question. I'm just very quickly, before I respond, I did want to offer my own welcome back to the University of Michigan community. We're just about to get underway for the winter semester. Classes, of course, start on Tuesday. And as was just mentioned, the Monday is our celebration of the legacy of Dr. Martin Luther King Jr. And I hope that you will join us in participating in what is really an exciting portfolio of events that have been planned. So turning to the first question, which is really a very important one, we are well aware of the continuing challenges that so many people are facing in the current context. And so to support faculty and staff managing dependent care in particular, the university is offering 2 new resources, and I'll just briefly describe them. First of all, the university has now a paid membership to care.com for University of Michigan faculty and staff. And that membership grants unlimited access to a network of caregivers to find ongoing care for children, for adults, for seniors, pets, a whole wide range of different types of things. And of course, it is a nationwide service. So the university membership will cover the access fee for employees at the university, but anyone who chooses to hire, of course, it is a fee-for-service program. Care.com should be available to faculty and staff by the end of next week, and we will certainly send out additional communication so that you have all of the details. The other new resource is a new family-to-family posting board for various family care needs from University Human Resources. And so faculty and staff can create and respond to posts about sharing resources and providing in-kind support. Again, childcare, tutoring, elder care with other employees. As a reminder that the work-life resource section of the university HR page has information about the continuing wide range of additional resources that are available to faculty and staff. Kids care at home for backup childcare services, family helpers, campus home network, etc. So this is a really important issue. We're rolling out these 2 new resources that build on a variety of existing programs.
Yeah, thank you for that. And I just personally want to put in a plug for care.com. I certainly use that myself when my kids were younger, and it was useful. So I hope it'll be helpful to a number of you. Now, the next question is sort of a broader question. It's the one that a lot of us are thinking about. It's, how are we looking ahead to address public health concerns in planning for fall 2021?
And that certainly is a question that is on the minds of many students, faculty, instructors. What is fall 2021 going to look like? So while it's premature to make a complete set of decisions now, we're certainly thinking about that and in the early stages of our planning. So I'd like to highlight 2 of the dimensions of how we're looking ahead to respond to that question. First of all, given all the uncertainties, and we're going to be talking more about some of those later in our time together today, we're going to consider different contingencies so that we can condition how we might roll things out on possible circumstances. And one key consideration, of course, is what percentage of our instructors, our students, and our staff are likely to have been vaccinated by midsummer. The higher that percentage is, the more likely that we can plan a fall semester that'll be much closer to normal. But if there's significant fractions of our community that will not be vaccinated, we would continue to implement a range of practices that we know from our experiences have mitigated the health risks. So another consideration, of course, is whether public health guidelines will still include the face coverings, distancing, de-densified spaces, et cetera. Another important component of the planning is to really build on all of the lessons that from the experiences that we've had so far. What worked and what are some of the things that we're working on to improve during the current semester. So, and I will reiterate that we've really had excellent experiences with the in-person classes that we had during the past semester and expect fully to continue to. So our goal continues to be delivering the best educational programs possible across our schools and colleges, but taking into consideration the health risks. We also recognize that the importance of giving people time to plan, and therefore that we have to balance that with waiting until we have more information. So in particular, we'll quite likely be able to say more about our largest classes for next fall before we're ready to announce a full plan. So I'll just end by mentioning that we're already hard at work with the schools and colleges to plan for the spring and summer terms. And many of those classes will be offered remotely, but we don't expect to have a fully remote spring and summer the way that we did the last time around. So let me end there.
Great, thanks so much. And I think, again, just highlighting that there are a lot of unknowns, but I think a lot of reasons to be optimistic. I certainly am optimistic that we're going to look more like usual, beginning with maybe the spring, summer. So thank you. We're going to move on now to student life questions and have a conversation with Vice President Harmon.
Thank you, Dr. Milani. And I want to say good afternoon, everyone, and Happy New Year. I think we're all excited to leave 2020 behind and move on to 2021. I'm really excited to welcome students back to the University of Michigan, whether you're here physically or virtually. So it's an exciting time of year. And I'll turn it over to Dr. Milani if you want to state the first question.
Yeah, absolutely. And basically just following up on your comments, this is, I think, a question a lot of students are asking, and it's one worth exploring, like, how can I get involved with on-campus events if I'm living out of state this semester?
Thank you. We have a lot of upcoming initiatives that were improved or newly developed with feedback from students, faculty, staff, and families. So whether you're virtual or here in Ann Arbor, I'll give you some examples. The first year experience program will host a series of events in January and February called Winter Semester Warm Up. We all need to be warmed up in the winter. And that features events hosted by the first year experience program and various partner offices. The Center for Campus Involvement is hosting a series of Finding Community in Virtual Spaces, and that will take place in January. The Community Matters Cohort program, which was actually introduced last fall, will relaunch winter semester on February 1st. Students can still sign up for available spots until January 21st. And that's a really great way for us to build a cohort for you so you can connect with other students. And if you happen to be in Ann Arbor, you can make those connections however you want. You can find safe ways to get together with small groups and go for a walk or just make those connections, but we want to facilitate that for you. And if you're virtual, you can still make connections. There will also be specific outreach to first year and new first year and transfer students in January to provide a connection for answering questions that students may have and to invite them to participate in various new student meetup activities. I've commissioned a task force actually late last fall to really focus on specifically creating new opportunities and safe opportunities to enhance student belonging and engagement. One of their key efforts has been the creation of a resource navigator program. Now that probably sounds like some fancy technology, but basically we're implementing this short-term navigator service this winter where we will invite approximately 1,000 students who are not already connected to a cohort or community. And they'll be invited to a brief conversation with a resource navigator, who is actually a trained student life staff member, to specifically check in with them and help them get connected to the right resources and opportunities and just to make sure that they're doing okay. In addition, we have a mix of opportunities lined up for students over the next few weeks, including the the virtual Winterfest involvement fair, so students can meet other student organization leaders and get involved, and also a career fair. And in addition to that, the UMix late night event and an international student mixer. So students can join virtually from wherever they are and make those connections that way.
Yeah, I'm really glad to hear that. I actually love the idea of a navigator. One thing I will just say that, Michigan, there's a bigness to the campus. And I think it can feel overwhelming, even in normal times, outside of a pandemic, it can be hard to find your people. But, just keep looking. And again, I think many students want to get involved, and you just jump in, find something. There's no risk, no reward here. Speaking of which, the next question is a little more specific, and it says, I was involved as a volunteer poll worker helping other students vote in the election last semester, and I want to stay engaged even though my winter semester will be 100% virtual. I'm interested more than ever in how to get involved in given recent events in DC. What can I do?
That's a great question. We've been hearing from students that they want to get more involved and they want to stay involved in activities around the election and governance. And the good news is that there are many events and opportunities stemming from the upcoming MLK Symposium, which starts next week on January 18th. And the theme of that program is, where do we go from here? I also recommend that students check out the Maze pages, where you can find filters and search options to find and join 700 plus activities and organizations focused on activism, governance, or service learning for student organizations. We have a democracy and debate resource site at speakactvote.umich.edu. Again, that's speakactvote.umich.edu, with other upcoming events, free courses, and resources surrounding civic engagement. I also want to give a shout out to the Ginsburg Center with a really, they will be offering a really exciting program called Pathways to Civic Engagement. You can find out more and design your own personalized journey by going to ginsburg.umich.edu. That's ginsberg.umich.edu. And there's also a Michigan Minds podcast episode about that activity. These are resources just to get you started, but if you're still not sure how to get connected and how to get involved with civic engagement or other activities, I recommend you Google happenings at Michigan and start exploring. And it's really a university-wide events calendar.
That's great advice. The happenings site is really pretty comprehensive. So again, check it out, kind of keep it bookmarked. So this last question is actually pretty, it's like kind of a precise question. At what % capacity are the residence halls on campus being occupied? Basically, what portion of undergraduates are here on campus during the winter term?
Right, so you may recall that we have a limited number of students returning to campus this semester. In fact, they're starting the move-in process over the next few days, and I'll be popping into some of the halls and greeting students as they return back. But we'll house approximately 3,000 undergraduate and graduate students who have clear needs to be on campus during the pandemic. And that's about 25% of our overall capacity. Just as a reminder, in accordance with our institutional public health guidance, there are clear expectations for staying safe and healthy in winter 2021. And Dr. Milani mentioned some of those earlier, and they'll be covered, I know, during this session. But if you're an undergraduate student on the Ann Arbor campus, you will or should have received an email for Dr. Ernst and myself explaining what those expectations are. And Dr. Ernst will talk a little more about that. And they cover flu shots and testing and so forth. But if you're not sure what protocols apply to you, you can go to studentlife.umich.edu and check out expectations for staying safe and healthy in winter 2021. So that information is there. We also know that this won't be a typical semester by any means. We're not out of the woods yet, but whether you're on campus or not, for students on a physical campus, there'll also be the added challenge of dealing with the pandemic when being outdoors is difficult during the winter. So we want to remind you to be safe. And so it is winter. When you catch a day or two and it's not too bitterly cold, go outside, mask on, socially distance, take a walk with friends, play in the snow, make snow angels, build a snow person, or have a snowball fight, but please don't hit your friendly VP. So remember, it is our shared responsibility to keep this campus safe this semester, and let's not get lax. We've got a ways to go, and we have to stay committed. Campus is counting on everyone to do our part. Thank you.
I'm just going to add one more snow activity from my era, which was traying in the Arb, which you can kind of imagine what that is. With sustainability, dining no longer uses trays, but I think, you can be creative, sometimes cardboard boxes, other things. But if you haven't been over to the Arb, go there. It's a magical place. And it is a really fun place to go sledding on whatever device you choose. So remember, there's no bad weather, there's just inadequate clothing. So stay safe and get outside. And with that, we're going to move on and now to talk a little bit more about health issues with Dr. Rob Ernst. So, Rob, welcome back. Thank you for everything that you've done to sort of get everyone back on campus. There's been a big push behind the scenes in terms of getting the testing protocols back up. And someone asked about arrival testing positivity rates and how many students have completed them. And, again, maybe you can talk about how the dashboard might lag because there's a little bit, there's some missing data so far.
Thank you, Preeti. And, I'd like to add my positive thinking for the upcoming new year and address this question in the context of a spectrum of things on how the campus response will be different in the winter semester compared to the fall semester. I feel much more confident about the maturity of the whole public health system to respond to cases now. We have had a really strong partnership with the Washtenaw County Health Department and expect to continue to do so. But, for university affiliates, cases that are identified are investigated by our team from EHS, and they've staffed up considerably to manage that load. We've built our own sort of contact tracing core of over 70 people that are really active in promptly identifying close contacts, and then working with our quarantine and isolation space to get those folks out of the community as promptly as possible. So that whole public health system is much more mature instead of being built in progress in the fall. We've greatly expanded our ability to provide testing to the community. We still expect folks, if they're symptomatic or if they've been a close contact, to get tested through a medical resource. So UHS for students, if you're symptomatic or if you have close contact, and faculty and staff should contact occupational health services. But for asymptomatic screening, we've greatly expanded the capacity through the saliva-based test and have, as you mentioned before, even opened up additional testing resources. We'll have the standing testing centers at the Palmer Commons and at Pierpont Commons, but we'll have a standing testing center also in the winter semester at the Intramural Sports Building and at the Ross School of Business, which we've heard from the students would be a much more convenient location for off-campus students, and encourage them to participate in weekly testing as well. So testing is a big change. We also heard a lot and from the community and from extended community, whether it's the faculty or parents and others who had questions from a range of, wide range of different kinds of questions. And trying to find the right person to answer their question was sometimes difficult, and trying to find emails and things like that. So we've stood up, and it's live right now, a campus COVID call center that's staffed by live people to address a range of questions. And we hope that'll help people navigate the challenging aspects of COVID and higher education. And to answer the question now, the other change that Dr. Harmon alluded to is that the density of students on campus will be lower. So the number of students that we had participating in the pre-arrival testing program was much lower than what we had in the fall. We again use Quest Diagnostics with an established workflow, and we opened the testing up on elective basis for student groups, whether it's fraternity and sorority life or the co-ops, but mandated it for students in university housing. We ended up with about 1,750 students enrolled, and we've received the results back. The tests that were done were just over 1,425. Fortunately, we've only had 5 positives from that group, which I think speaks to something you said before, which was that if you're grading on a curve, Michigan's doing better than most states. And I think that it's a confidence builder that the students are preparing for their experience at U of M and have obviously been limiting contacts if that's the case. So that's a 0.3 something % positivity. And those statistics will be uploaded to the Maze and Blueprint website. And I think they may already have been this morning. I'll have to double check that because I know people are interested in the data for how things are going.
So speaking of testing, the second question, how do off-campus students sign up for the mandatory weekly testing? And again, let's take mandatory out of that. In a sense, can we just walk through, and hopefully most of our students are in the program, but if they haven't been, can you just talk about the process of signing up?
Yep, sure. It's, there's a tab from the Maze and Blueprint website that talks about testing, and they've rebranded that now. I know there was a lot of concern about the testing program in the fall being an opt-in program, and that's no longer the case. It's available to any U of M student and any faculty and staff who's coming to campus to follow what's on the website. Is just 2 easy steps. You register and then sign up for a time. And the registration piece is really important because we have to validate a certain number of pieces of demographic information, and there's a consent piece to doing the test. So that's an important step. But then the scheduler is actually a new piece of technology that we've layered in, and it looks really slick. It works very effectively, and it will provide options on any given day that what works best for them, and then each of the sites and how many slots are available to accommodate, individuals who want to sign up on those times. So it works really, really well. And then you get confirmation and just show up for the test. If people find that they want to get into a cadence of doing a weekly test, they can sign up for it's not just limited to the one time. You can actually sign up for a series of tests if that's something that will work for your schedule as well. We just think that given what we know now about the spread of the virus in asymptomatic people, getting a sense of what's happening in the community, getting tested regularly is a good idea, and we will make that widely available to folks.
Thanks. And the president's email that comes out later today will actually have a link also to that site. And Rob, just sort of related, it's this idea of compliance. And I know you've really had a lot of discussions, really trying to be student focused and not to disenfranchise anyone, but also to have some enforcement of this. Can you talk about, and this question is, will research faculty be required to track or document that undergrads are participating in the testing program? Now, I would expand that to sort of faculty in general.
Yeah, I think the mandates for testing do apply to undergraduate students who are coming to campus for classes, or if they're living on campus, or if they're using university facilities. What we've already launched, as you alluded to earlier, was a lot of really, excellent technical work by our folks in tech services who have changed the ResponsiBlue application so that ResponsiBlue knows who is enrolled in undergraduate classes, and for undergraduate students, there's a different look and feel to the application. And if one thing I hope is very different in the winter semester, it's socialization of regular daily use of ResponsiBlue by people that are coming to campus, and that applies for all of us. The mandates are for the undergraduate students who we know. So we think about a tiered and layered approach to assessing compliance with the mandates. For students that live in university housing, we have established procedures for tracking the compliance with doing a weekly test, and we'll be following up with them directly. That's a captive audience that we have a lot of interaction with, and I don't have a lot of worry about tracking those folks down and working with them individually about their weekly testing. For students who are enrolled in classes that have an in-person component, and we think that's a number that may be as high as 7,000, we have been partnering with the academic units to know those classes and know the students who are registered for those classes. And we are going to and plan to, we've established a compliance tracking team that will be monitoring the compliance with the weekly testing for all of those students who are enrolled in those classes on a weekly basis. So we expect people will engage in the testing. We heard it loud and clear through the fall semester that people wanted more testing. So I don't expect this will be a big problem. Now that we've made the capacity to provide the testing available, I expect people will engage in that testing. For those undergraduate students who are not either enrolled in an in-person class or living on campus, tracking with the actual visual display of the responsive blue provides a way of ensuring that people have completed their weekly test before coming to those facilities, whether it's for a job or for study or for some other reason. And based upon what we know about expected traffic patterns through the various buildings on campus, there will be some in-person greeters to assess and asking people to look at the responsive blue. And it should come as no surprise to anybody that they're going to be asked to check their responsive blue. So because this is a layered approach, the very first layer is the personal responsibility to be checking in and understanding what your level of compliance will be. So I hope that people don't find out that their responsive blue is going to say expired as somebody is asking them to look at it on campus. So that personal level of knowing what that status is very important, but we expect that we'll have stations where people will be asking them to look at that.
That's great. And one other piece that you and I had talked about was the prior positives. Do you want to just mention that? Right.
That's a really good point, Preeti, and I'm glad you mentioned it. Any student so the expired will be the responsive blue for an undergraduate student will read expired if they haven't had a test at a U of M lab within the last 8 days. Now, there will be some other conditions that will have it say expired also. If somebody has tested positive at a U of M lab, it will say expired for the next 10 days. And if they are somebody who's been identified as a close contact or required to be in quarantine, it will say expired during the course of their prescribed quarantine period. Alternatively, someone who has tested positive and then served their period of isolation, following that, based upon the current understanding, is that those are folks who shouldn't be tested again for another 90 days. So what we'll do after the responsive blue will know to have it be in compliance for the next 90 days. Now that's only if it only knows that if it's a U of M lab, but if somebody tested positive perhaps over the break at home, and they should upload that, let us know about that. There's some places on the testing site on the Mason Blueprint website, and this has been part of the communications as well, to upload the outside test result, and we'll screen that and then plug that into responsive blue. It's a very important point.
Great, thanks. And I'll just throw out the fact that this is so dynamic. There is talk, at least from the CDC, that 90 days is actually going to be increased to much longer. So we're learning as we go. And again, flexibility and being nimble. So we're gonna actually move on to Dr. Sinti. If we can get those questions up, and maybe we can keep Dr. Ernst in the window here. So Sandro, I know you've been like all over the world talking about vaccines, and we're going to try to do this more rapid fire. And obviously this is really dynamic. I think a lot of people want to know what's going on at Michigan Medicine, how many people have been vaccinated, and really what's happening at this moment, because there was a little bit of a like bumpiness, I'm going to say, in terms of the state supply, and what's the latest?
Yeah. Yes, let's talk about that. Yeah, welcome back, everybody. And all this is good news. We have vaccine. We'll eventually get everybody vaccinated. But one of the things, so at Michigan, we started in earnest vaccinating about on the 21st of December. We vaccinated about 200 people the week before, but we were really using that to get our feet under us. And then since that time, we vaccinated about 22,000 people. The problem is we haven't gotten as much vaccine as we can give in this week, and we expect that we're going to have a deficit next week too. So that's a bit of a concern. We're hoping that those pipelines for vaccine will open up soon. We have a great system right now. We're vaccinating at the stadium. We're vaccinating within the hospital still, and we're vaccinating outside at some of our outside clinics. And we plan to open more centers for vaccinating. The principles that we use are really, we want to vaccinate as quickly and as safely as possible. So we have to put in programs, and we think the way to do it most quickly is really to do mass vaccination versus sending it to clinics and doing it. We want to follow the state and federal guidelines because those are important. They're set by experts. We want to protect our high-risk populations, and that's why we're about to go in and vaccinate our 65 and overs and some of the frontline workers who have real high exposure to people with potentially with COVID. And then we want to dispense this equitably too. So you can dispense dispensing vaccine can be done in a manner that is not as equitable, meaning, to give you an example, when we first went through the hospital to go to separate units to vaccinate, we didn't feel was equitable at Michigan because you would miss people that weren't there on that day. So what we did is we had a random system to be able to pick people and get them to schedule in a randomized manner that was much more equitable. So those are the principles that we're using. We are moving forward. We can move forward quickly. We just need vaccine right now.
Yeah, I think you touched a little bit on the second question. Can you discuss how decisions are being made about community members? And again, I've emphasized to people that it's not our decision, it's really following the state guidance, but can you talk about that a little bit?
You mean overall prioritization of the vaccine?
Yeah, like as we're getting into the next wave of the 1Bs.
Yeah, and the priorities, they're set by the CDC, the Advisory Committee on Immunization Practices. They're a committee of experts that the CDC listens to, and they put out recommendations, and we follow those recommendations. And then the state follows those recommendations. And so what we did first was we vaccinated our healthcare personnel. So that was everybody within the healthcare system. And on December 31st, Dr. Khaldun allowed us to expand that to include almost everybody within the healthcare system. And we're just at the cusp. We have maybe 2,000 or 3,000 people left in that group, but we vaccinated, as I said, 22,000 people so far in the healthcare personnel setting. The next group is what we call phase 1B, and that will be people 65 and over, and then frontline essential workers. So those are people, the frontline essential workers are the people who can't help but have contact closer than 6 feet. So if you can do your job 6 feet away, you might be an essential worker, but you're not considered a frontline essential worker at this point. So on top of the 65 and overs, the frontline essential workers that we'll be vaccinating will also include some of the university groups, such as transportation. The RAs, we feel, and the residency hall directors have to have close contact with the students. That can't be avoided. So that will be some of the groups that will also be involved. There are others too. The environmental services that have to clean up places and have to be in close contact. So those are some of the groups that are going to be in 1B. In the community, it'll be 1B, the teachers will be vaccinated. Also, there'll be food and agriculture folks, police, fire are getting vaccinated in that stage. And there are others too. Again, those decisions are they're made at the federal level, and then we are following those recommendations.
Thanks. And I'll just add that anyone living in a nursing home and again, staff in the nursing home, we're also considering that 1A.
Oh, absolutely. And yes, thank you, Preeti. That's right. Very important.
Yeah. And again, keeping in mind that that's where a lot of the deaths occurred, unfortunately. So, students without underlying health conditions, so like healthy students, what's your best guess on when they might expect to get the vaccine? My co-chair in our vaccine committee, Stan, is always very
optimistic about this. And so I take my lead from him, and he was thinking that we would potentially get to almost everybody, which is phase 2. So phase 2 is the group in which students would fit. And we still have to get through phase 1B and phase 1C, and then phase 2 is everybody else. And I would think that we would hopefully start that maybe late spring, early summer, if we get the vaccine. Okay, so we have to, the caveat is we have to have enough vaccine. If we have vaccine flowing to the level we want, we can do quite a bit there.
Yeah, the next question, you've sort of addressed this, but let's address it specifically. How will graduate students, so teaching assistants, research assistants, and those on fellowship be classified? Are we considered faculty or students? What vaccination phase group will graduate students fall under?
That one, it's still expected that it would be under phase 2. And even faculty would be that don't have high risk conditions or aren't over the age of 65 would be under phase 2 at the moment. There are discussions going on about maybe phase 1C is where some of those groups would fit, but that's not fully developed yet. So that may come later with the CDC recommendations.
Yeah, and I think that the sort of the unknown is really vaccine manufacturing, like where it's going, what the new administration is going to do, and frankly, the Johnson & Johnson vaccine, which has been submitted to the FDA, but they're not really meeting in the next few weeks. So no one is really expecting the EUA, and you may know more about that, Sandra. But right now, there's not, like, on campus. My sense is that the system is ready to go as soon as there's input. It
is, and we haven't been able to do. We've stopped doing first doses. We have to do 2 doses for each of the vaccines we're giving, and we have stopped doing first doses because we don't have enough vaccine. We're hoping that next week we'll be able to do some of those first doses and actually start to get to our 65 and overs. But we won't know till later today. And then we won't get the vaccine till probably next Tuesday. So we won't have the capabilities that we want until about Tuesday of next week. Oh, and then even then we may not have all the vaccine we want to dispense.
Great. You sort of hit on this. Are less vulnerable community members being prioritized for the vaccine? I mean, again, like if you don't meet the age or vulnerability medically, or you're an essential frontline person or K through 12, you would actually fall in, at this point, under phase 2.
Yeah, there has been some consternation about some young folks in the hospital setting, right? Hospital personnel. There have been some young hospital personnel that are vaccinated, but those are considered critical to the mission of the Michigan medicine. And so you might, and again, those were expanded by Dr. Caldoun, the state medical director's directive to do that. So, but in general, yes, less vulnerable folks will be prioritized for phase 2A.
The next question, and you mentioned this talking about RAs. When will the vaccine be available to staff and student service roles? We'll be having direct contact interaction with students. And again, I'll throw that to you and Rob, if there's anything to add.
Yeah. Rob, I don't know if you want to start out with that.
Yeah, I mean, we're working within the parameters that were established by the CDC and the state, and we've been able to, classify several categories that Sandro's mentioned. I think RA staff and other hall staff who are living in the res halls, the security folks or the DPSS staff, transportation folks, our dining staff who are working on site, so whether in a prep role where it's tight conditions or in a serving role, and then the environmental services staff, because it's, may or may not be a spacing issue in that case and not be able to engineer their workspace, but they may be coming into contact with body fluids and other things. So those were the 5 categories within the campus roles that were accepted into the 1B categories, my understanding.
That's exactly right. And we will be helping to vaccinate those groups too. So other students, again, if you can maintain or if you can do your job with 6 feet of distance, wearing a mask, right now they're not categorized as frontline and are not 1B. They would be maybe in 1C, but most of the faculty, staff, students, we're looking at phase 2. But again, that may change.
You know, Sandra, you talked about Dr. Khaldun and, you know, how
Yeah.
she allowed for others to be vaccinated. This is a question is, why do they classify all of Michigan medicine employees in 1A when not all of the employees are essential frontline workers?
Yeah, I think some of it was that at that time, on December 31st, we actually had quite a lot of vaccine out there. And Dr. Khaldun was trying to get all the centers to use all the vaccine that they had. And so and still MDHHS is asking us to use 90% of our vaccine within a week, which we've been doing at Michigan Medicine. We've been doing that. So what happened was a lot more people were drawn into that 1A category. Remember, when I talked about our priorities, we do have the priority to protect our populations at highest risk, but another priority is really to move vaccine quickly. And so when you're balancing those priorities, sometimes people out there will see somebody who, my gosh, why are they getting vaccinated? And I haven't yet gotten my invitation. It may be that balance, that push-pull that we're having with vaccinating quickly and having to vaccinate everybody who's high risk. So I think that's one way to explain that 1A category encompassed those people who were then before the 1Bs, and the 1B wasn't opened up till about 6 days later. And so those people had gotten their scheduled appointments. And so I think there's still going to be some of that going on out there, and we should, I think, trust that everybody's trying to do the right thing here and get people vaccinated and get the right people and get everybody vaccinated, but start with the most vulnerable.
Yeah, I would just reiterate that. And in fact, it's you know, just from personal narrative here is that I actually was later than most of my colleagues, including Dr. Cinti and others. And I was kind of like waiting for my invitation. And, you know, I did get my first dose. I actually haven't had my second dose yet, even though I'm a frontline infectious disease doctor seeing patients, and I'll be rounding tomorrow.
Yeah.
So I'll be getting, you know, so the thing is, it's imperfect, and it's not this moment that, oh, I have the vaccine, now I'm free. I'm like, I'm totally protected. And reminder that this is a process. Everyone's going to get vaccinated. There'll be vaccine, but we all need to be patient. Speaking of which, should seniors and those planning to graduate in 2021 still plan on signing up for the vaccine?
Yeah, I think so, yes, because if there's the opportunity, I think everybody, if you have an opportunity to get a vaccine, get it, I think, because we want to be able to get people vaccinated.
I'd add that at least fill out the Blue Q survey. You know, I think that's something that everybody can do right now. Even people who are still kind of on the fence about whether or not they want to receive the vaccine or want to wait, it's really helpful. It's something that people can do is sign up for the Blue Q survey. The other is get registered to have an MR, or to have a registration within Michigan Medicine and a portal account with the hospital. I think that's something else that would be really helpful, because that's how the invites are going out. So it's something that people can do. You know, I know many in the university community already have the Michigan Medicine accounts and the portal accounts, but it's something you can check. And I know we still need a lot more folks from the campus side to fill out the Blue Q survey. That would be something that people can do now.
Yep. So get in line. And just a word on the portals, a little bit unrelated to this, but, you know, for those of you who have family members who, you know, older adults in your family who maybe are not on the portal, please help them sign up. There's a little piece that the Michigan News put out today that highlights work that my team with the National Poll on Healthy Aging did. And we find that even with telehealth, it's only about half of older adults have access to these portals, and the portals are the fastest, easiest way to get scheduled. I know with my own parents, they actually are scheduled for next week. Who knows if they'll get, not at Michigan Medicine, but another hospital locally, whether they'll actually get vaccinated or not. But again, access to portals is going to make it simpler. So that's something you can do while you're waiting. The next question is, where do librarians who have weekly interactions with students fall in the phased plan for vaccine rollout?
Yeah. Yes, I think they probably phase 1C where it would be under the media kind designation for essential worker. Clearly, librarians are essential workers, but if they can maintain that distance right now, they're not considered in 1B. B1C,
Great.
Yeah.
Great. And again, I think a lot of this is subject to change depending on if there's a whole lot of vaccine that arrives. I mean, one thing to keep in mind that 1B is big. You know, 1B is a really large group. When you talk about 65 and over and those with medical conditions, that is a very, very large portion of our population. And so there's gonna be a big difference between 1B and 1C.
Yeah, and I can tell at University of Michigan, just 65 and overs is 200,000 people. The patients, the patient population.
So
it's
across
big.
our state, that's, you know,
Yeah.
it's probably in the million range plus, you know, so. Will non-university spouses be provided the vaccine?
So we don't have a system for that yet. And that is a good question. It's one we continue to look at. We haven't done that yet. Right now, as a matter of fact, we just haven't started giving the vaccine out to our 65 and over patients, but we will be looking at whether there's an easy way to do that. It would be nice. Right now, there's not.
Yeah, and again, right now could look very different than what it might look like in a few weeks. And I was on the phone earlier with the schools, with one of the local schools, and you know, the teachers, I had expected that they might be vaccinated, and it sounds like they're being told now mid-February to March. So I think things are very, very fluid, and just ongoing patience and just sort of getting ready and continuing all the mitigation that we're doing. There's some more questions around COVID. I think this first one is one that has come up a lot. If someone recently had COVID, let's say December, should they still take the vaccine, and will they be required to wait longer before getting the vaccine due to their recent exposure, giving the opportunity for others to get vaccinated first?
It's a great question. And what the CDC would say is and what we know now is with natural infection, you're probably protected for at least 90 days and probably much longer than that. There was a study that just came out in Science that showed that people have protection probably out past 6 to 8 months. So the answer to that is you don't have to, and you can get it, but as a deferral to others who might need it, you might want to do that. So we're not asking you that question. We're not saying if you had COVID, unless you have COVID right now and are still having COVID, we wouldn't give you the vaccine. But if you had COVID, we're not asking you to step aside and not get the vaccine, but you certainly could, and you would be safe.
Okay, we're going to do the last two quickly because I know we're running out of time. Is it true if you had COVID that you are immune from getting it again in 3 months?
Essentially, yes. Now, yes, let's say yes. Yeah.
We're going to say yes, and maybe longer.
Yeah.
But you can still get reinfected. It doesn't mean you don't wear a mask. Okay.
Right.
Are there opportunities for campus community members, especially those outside the medical community, to assist with vaccine rollout, with check-in, et cetera?
Oh, absolutely. Preeti, maybe I can send you that. I don't have it.
Yeah,
I don't have it at my.
We can get a link out to the group. And
oh, great, because you did that. Didn't you actually go out and vaccinate people?
Yeah. I did. I grabbed some volunteers. People have
So
a hard
yeah,
time
you can.
They have a hard time saying no to me. So good. Can you still shed the virus after receiving the vaccine, and what precautions should be taken?
The answer to that is a definite maybe. We're not completely sure, and that's why the masks won't come off, because they didn't do those studies in any of these trials. I think AstraZeneca or Janssen is doing those studies, but these have to be done. So that's why you have to continue wearing your mask, so that in case you do get it, you're not transmitting it, particularly in light of the variant you talked about, Preeti.
Yep, and the last question.
Preeti, can I add to this any student who falls into a mandated testing category who has received the vaccine will still be expected to get tested?
Yep.
And similarly, anyone who's been vaccinated, who's been identified as a close contact, will still need to be subject to quarantine.
Yep, thank you.
Right.
Those questions have come up. Patty Hearn, the Dean of School of Nursing, asked those specific questions, and they're on our FAQ site. The last question before I turn it back over, does the vaccine design for one variant or several variants? And are we concerned, I guess, with these emerging variants? Sandro, do you want to just comment on that?
We're concerned in that there are variants, and the more people, so the higher the infection rate is and the positivity rate is within a population, the more likely there are mutations. Coronaviruses don't mutate as well as influenza viruses. They do mutate though, and the example being the one variant. Now that one variant is still sensitive to our vaccines so far. So there hasn't been a change in the virus that makes it resistant to the vaccine.
Yep. So lots to keep an eye on. Everyone be patient, be safe. I'm going to turn it back over to President Schlissel. Thank you so much.
Thank you very much. Look, as you can see from these questions, particularly around vaccine prioritization, this is very messy. A lot of these decisions are arguable. A lot of the advice that we're getting or mandates from the state and from the feds are changing with time. And all we could ask is your forbearance. We are trying to vaccinate as many people as we can, as efficiently as we can, using all the vaccine we can get our hands on. And we're trying to follow guidelines as best we can. I know there's a tremendous demand out there to be vaccinated, which is a fantastic thing. We're going to get to everybody. We right now have a capacity to do 28,000 people per week if we're operating on all cylinders and the supply is not limiting. So do the math. We're going to 28,000 people, we would make it through our undergraduate community in 1 week if we had adequate vaccine, for example. So it's really the vaccine supply. I'm confident that that's going to ramp up. The existing vaccines are being made increasingly efficiently, and then new vaccines are going to be licensed or at least preliminarily licensed and add to the supply. So we just have to, be a little bit patient and continue, as Dr. Malani said, to be incredibly vigilant, taking care of yourselves and others, masking and distancing and the like. A lot of these questions about, do we have to keep masking after we're vaccinated? What about quarantine after we're vaccinated if we're exposed? Information will become available, I'm hoping, in the months ahead that will let us make much more informed decisions and give better and better guidance. This is not a situation where we know everything and it's just a matter of telling everybody what to do. The information's changing in real time. Think back a year ago. A year ago, this wasn't on most anybody's radar screen. And in the course of a year, we've gone from the first description of a new virus to sequencing its genome, to developing a diagnostic test, and now having 2 highly efficient vaccines. That's breathtaking. If this were 50 years ago, you'd all be waiting to get the infection and terrified. So progress is spectacular. Everybody is really working hard and doing the best they can. We received many, many more interesting and important questions. We're going to mine those questions. We're going to pop them up on FAQs, and we're going to get back to you at our next sessions with answers in real time as well. So let me thank all of our participants today, especially Dr. Sinti and Dr. Malani and Dr. Ernst, who are basically working flat out. And the question came today, what are we doing to reward these people? I was at a session earlier today, or to give them relief. They're not getting relief. They're basically working 16 hours a day. And that's true for everybody, I believe, that's trying to help keep our community safe. So please stay safe, everybody. Have an enjoyable weekend. I hope the semester gets off to a great start. Get your mandatory testing, get your voluntary testing, queue up for the vaccine. I can see the horizon. There are better days ahead. Take care, everybody, and thank you again.